can you're streaming okay. Let's check again. So okay, so we are live on Instagram too.
Okay.
And so we're good. So this is good. And so Dr. Adiola, are you there? Okay.
I'm here.
Okay. Let me maximize to see. Um yes, this is the screen I like. Welcome.
Thank
It's
you.
great to have you.
Thank you.
Thank you for your support, for the gift of your time. Thank you for your advocacy. This topic is important, and then as we celebrate, is the last week, is the last day,
It's the last day.
is the last day of Mental Health
Mental health
Awareness Month.
awareness.
Yes,
Yeah.
so I'm glad we get to do this,
Yeah.
and we're able to give value to, and raise awareness and advocate for, and do what we love to do. So
Absolutely.
without wasting any additional time, I'm going to just have you introduce yourself and your
Okay.
special interest, what you do, and you know, go for it.
Thank you so much, Dr. Tiwa, for having me. Hello, everyone. I'm Dr. Adiola. I'm a psychiatrist and a mental fitness coach. I'm the founder of Talk Mental Health. I'm very, very passionate about, helping people live their best lives, basically. Yes, I'm a psychiatrist. I'm a doctor, right? But I believe that every individual has got gifts, talents, and they should express themselves and be the highest version of themselves. And I know how mental health could either impact, make you, be your best self, or mar it as well. So your mental health has to be top notch for you to become the highest version of yourself, basically. So because I understand this and having spent years of my life in the hospital setting, saying how mental illnesses impact people's productivity, reduces their quality of life. I just thought the best is to come into the public space to advocate for good mental health and teach people skills that would help them thrive and become the best versions of themselves. I also showcase, tell my own story and show people my journey, letting them know that this is how I've done it. So I'm not just telling you what to do. I've also walked the path and I'm showing you my process so that you understand that this is not I'm not doing performing magic. I'm just
Mhm.
letting you know that it is doable. So that's what I do, basically, showing people how to be intentional about their mental health, advocating self-care, advocating showing up as your authentic self, being audacious, being courageous, not staying in your comfort zones, trying to push and keep going. That's what I do, basically. So as a mental fitness coach, and of course as a psychiatrist in a hospital setting, I treat people that have got mental illnesses. Yeah, so that's a brief introduction of who I am.
Thank you so much for that lovely introduction. And it just shows that you're the right person, the right fit to discuss these topics because of your own journey. And for those that don't know me, I didn't even introduce myself. I'm Dr. Tiwalala Oshinfisan. I'm a psychiatrist. I'm US based psychiatrist and a mindset strategist. Yeah, I help professionals, highly skilled professionals and healthcare professionals achieve, peak mental performance in every facet of their lives. So thanks again for your patience. And we'll delve right into the lovely questions we have today to have a robust discussion. Dr. Adiola, could you please tell us or define to us what is burnout? We
Ah,
hear it. A lot of people, burnout right now is almost becoming a loose word. I'm burned out. I'm burned out. Anything else, I'm burned out. You know what?
yeah.
I can't take it. I'm burned out. And so, could you help us, for the purpose of this discussion, to know the context and what it means when we hear burnout?
Okay, so not until 2019 did burnout become or became an occupational phenomenon. On there's this classification, I mean, like a book that we use to make diagnosis of mental health illness. illnesses. Burnout has always been, thrown around. Everybody knows what burnout, from the word burn and out, that means you're stressed, you're tired, or something, you're exhausted. But until 2019, it then became an occupational phenomenon in what we call ICD-10 International Classification of Disease. It's more like a Bible for mental illnesses, what we use to make diagnosis. So it's not necessarily a mental illness, but it is an occupational phenomenon because it's the diagnosis you can make, or it's something you can have, a syndrome you can have related to your work. So you can't say you're burnt out, outside work. It has to be in the workplace. So if you're using it loosely and you're not working, then you're not burnt out. It's something else. So it has to be within the workplace. And of course, it's a syndrome that is characterized by depletion of energy. You're exhausted, you're tired all the time, you're fatigued in the workplace. So if it is outside work, then it is not then if you're outside work and still tired and exhausted, then you're probably not burnt out. So burnout is related to work environment. You're depleted of energy, you're exhausted, and you become cynical about your work. You don't give, I don't want to use give a damn, you don't care about the work anymore. You lost
Pretty
interest,
much.
basically, or about the work. It doesn't give you that satisfaction and fulfillment you want, and you're always tired around work, you're anxious around work. That's what burnout is basically. It's a syndrome, like I said. And interestingly, a lot of people are experiencing burnt out, especially because of how the system is the system of whatever work you're doing is created in such a way that it expects a lot from you, so that much so you don't have time outside work to even rest and recover from the work. So even if you're working 9 to 5, Mondays to Fridays, you find out that at home, the Saturdays and Sundays you've got, you perhaps would have some extra work that you need to do. I mean, some work you need to do to be able to complete your task outside your 9 to 5 job. And that's how the system is, which now makes it difficult to manage. And a lot of people are burnt out as we speak.
Thank you so much for giving that context. So what would we say then? So for our audience, we have those that have work. We have those that maybe not burned out by work. Maybe they're burned out by family. They're depleted. A mother, a father, a sibling, relationship. What do we call that? What would we say when someone is depleted and they really just don't have much energy, like you said, to give or to even recover, and they're just depleted? What would we say so that for our audience
Yeah,
listening to
I
us,
think
maybe
I
they're
would
like,
just
you know
call
what,
that.
my work is my escape. Maybe my work actually is the best thing that is happening to me right now. But as a parent, as a spouse, I'm done. What would you tell them?
That could be something else. It could be that you're just tired. It could be that you're exhausted. In severe cases, it could be related to depression. It could be related to anxiety. It could be related to chronic fatigue syndrome. In terms of mental health. So we're talking about today. It's about mental health awareness, right?
Correct.
So in the context of mental health issues, it may be another diagnosis. But when you're talking about burnout syndrome, it is in a work
In
environment.
the
It's
context of
an
occupational.
occupational phenomenon that is
Yes.
in a work context. So yes, you can be outside of work. So and when I'm talking about work, it might be your business. So work is also your business. But then I know that some people might argue to say, "Oh yes, I'm a full-time housewife, for
Mm-hmm,
example,
mm-hmm, mm-hmm,
and I take care of my children and all of those
mm-hmm,
bits, and that's
mm-hmm.
work." But then
Yes.
that could be work. You get what I mean? Because of
Yes.
course, trying to
Yes.
put the family and making them get ready for school, doing all of
Yes.
those bits can be considered work. But to be honest, if you want to look at the context with which burnout syndrome has been defined by the World Health Organization in that ICD-11 that I just told you, it
Yes.
has to be related to work, like work, not
Work, work.
the other
More
work.
just anything. Thank you
Yeah,
so much for that clarification. So in England, you guys use the ICD-10 or 11. We
yeah,
use we
the
use
DSM-5.
DSM-5. So it's for
I
people
know.
listening to us, this is where countries and continents collide, and that's the amazing thing that we get to discuss this from different perspective and different countries. So you are right, it's an occupational hazard for us for burnout. But like you said, for the purpose of mental health awareness, we're going to put all of them in the same. Maybe we'll do occupational hazard. Then we'll call it emotional exhaustion for
Yep.
everybody too.
Yep.
So as a mom listening to us that is emotionally exhausted, a father, a sibling, we'll just we'll call it that. And while we're talking about that, I will also want us to talk about high functioning depression. What would you say about that? Which is what you were saying, that maybe the high functioning depression or the exhaustion is, we're already on the spectrum of depression now outside of the work environment. What
Yeah.
are the signs that you say that
Mm.
someone will know that, hey, ding, 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 you are getting emotionally exhausted to the point of either burned out or even depressed?
Yeah.
What would you say are the early signs to look out for in ourselves and in others?
Okay, so in terms of the signs, I'm just gonna go straight to it. So if you're, sometimes we say sleep, right? And when you wake up from your normal 6 to 7 hours of sleep, you're supposed to wake up and be refreshed. But when you wake up from sleep and you're still tired, that could be a sign of burnout, especially if you're going to work. So if you've slept on a Sunday evening and Monday morning is your work day, and you're supposed to go to work on a Monday morning, and then you wake up feeling tired or you're anxious, or even towards the evening of a Sunday, Saturday you're excited, Friday, thank God it's Friday, you're excited, and Saturday you were happy, everything is going on well, and then towards Sunday evening you started feeling anxious because you know that I'm about to, Monday is about to, to come, or to start, and then you wake up in the morning, you're tired already at the beginning of the week, so to speak. That could be a sign that you're burnt out. If you become forgetful, so you know your capacity before, and you know that you can retain information, you're quite smart in terms of doing your work, getting your job done. But then you notice that you're kind of sluggish in terms of retention. You can't pay attention. You can't focus at work. Then that could be a sign of burnout. If you realize that the job that you used to love, you're quite passionate about it. Say, for instance, as a psychiatrist, yes, I see patients, or you're a doctor, you see patients, or you're a nurse, you see patients, you're an accountant, you like all those kind of jobs and all. But then you realize that you started losing interest in your job, you don't have motivation and all that. It could be a sign that you're burnt out. Fatigue, getting exhausted all the time and all. And the truth is that there's a difference between high functioning depression and burnout. I just want us to note that. So when I said the other time, burnout is an occupational hazard, it's related to work. So when you're outside work, say for instance, you go for a vacation, you won't experience any of the symptoms. No fatigue. You will sleep. You will sleep. You will enjoy the sleep. You will feel happy. You will rest well if it is burnout syndrome. But if it is high functioning depression, even when you are out of the work environment and you are on vacation, you may struggle to rest. All you'll be thinking about is work. You will still struggle because high functioning depression, as the name implies, high functioning. Yes, you have symptoms of depression, but you're working, so you mask the depressive symptom with productivity. So even when you go on vacation, your mind is still working and you can't really rest. So you don't feel refreshed when you go on vacation. So that's the difference between burnout syndrome and high functioning depression.
Wow, you see why Dr. Adela is the best person to give us this lovely, this robust discussion. I love the way you differentiated both, because easily, even though one may lead to another,
Absolutely.
it's very
Absolutely.
key to know the difference. So I hope you listening to me, you're taking notes, and you're seeing that
Mm.
maybe you're not yet depressed yet, maybe you're just on your way, and this conversation may help you or help someone you know. So, Dr. Diola, what would you say are the risk factors? So,
Mm.
I like my job. I'm a psychiatrist. I'm a mom, I'm a
Mhm.
wife,
Mhm.
or I know someone that is an engineer, is an accountant. What are the risk factors? I have a friend, so maybe I'm not the one I'm worried about, but I have a family member. What are the risk factors so that I can be like, oh, Dr. Adela just mentioned the risk factor. I better watch my husband. I better watch my child or my sister. what would you say are the risk factors?
So, I like to divide the risk factors into two. So there we have the internal factors and the external factors.
Okay.
And recently, I think I shared a video on how sometimes we focus more on how our job is burning us out rather than focusing on how we ourselves are getting ourselves burnt out in the workplace. The system is structured so in that way we can't change it. But sometimes you have to start looking inward to see how you are contributing to the burnout syndrome in itself. So that's why I'm going to start from the internal factors. So if you are a kind of person that have got perfectionist traits, so you can't delegate, nothing is perfect for you. I mean, you continue to work and get yourself, worn out just because you don't see something good about what you've done. That could contribute to burnout because you spend more time getting your tasks done rather than the little time that you're supposed to use because you can't see that it's good enough. So perfectionist, having perfectionist traits, perfectionist could be at risk of burning out. They, of course, are at risk of depression and other mental health illness. But burnout, yes, because you yourself would criticize yourself before others start to criticize you, basically, if you're a
Yes, yes,
perfectionist.
yes.
So the second thing is if you have some internal struggles yourself, trauma, unhealed trauma that you haven't worked on, and you're burying yourself in your work. So that could lead to burnout because, of course, if you're going to work, you want to go with your old self. So, but if you're not working on your internal self to see where you're struggling, what you need to work on and improve on, that could be a reason why you're burnt out. So you become, burnout, when I talk about some of the extrinsic factors or external factors like, criticism and all that. So if you have internal struggles or trauma that you haven't healed from, you become rejection sensitive. You won't be able to
Yes,
accept criticism. So
yes,
it's not necessarily about what your supervisor or your line manager has said. It's just because it has triggered something in you
yes.
that you need
True.
to work on. So
Very true.
until you start becoming self-aware enough to know that I've got some struggles internally, then you become more open to feedback and say, okay, I'm not going to personalize this feedback. It's just for me to get better. So those are these things that you need to work on internally. Another thing that I would say internally is if you're a kind of person that you struggle to rest. So some people are quite hardworking. We have got people that got type A personalities. So they are quite ambitious, overly ambitious. They're go-getters. They just want to get things done. They struggle to rest. Even when they're supposed to sleep, their mind is not sleeping. That could put you at risk of burnout. Yeah, it could put you at risk because, yes, the personality trait is good, right? But it could be that you have to start learning how to rest. So
Correct.
that could put you at risk of burnout. So then going on to, of course, the external factors, we all know what that is. Workload, the workload is too high. If you have, highly critical bosses or, managers, if you have, if the work, even commute, as little as commute could, if you're working
Absolutely.
far away from home, that could add to your stress and all those bits. And also if you're in a job that you don't really enjoy. So say for instance, you're just there for survival to make ends meet and I have to just pay the bills. So you've not really seen it as a passion, something you're passionate about. So every challenge you face there becomes a struggle for you, and then that could lead to burnout for you. So those are the signs that what was the thing I said? Risk factors, right?
The risk factors, yeah,
Yeah,
yeah.
that's
Well,
just there. And
welcome.
when
Yeah.
talking about high functioning depression,
Mm-hmm.
for high functioning depression often always come from a place of trauma.
Okay.
So high functioning depression, because usually if you're depressed, you're not supposed to function. That's the typical. So when you're depressed, you're not meant to function. So one of the criteria for making a diagnosis of depression is after you've all those major criteria that we know, low mood, loss of interest, and all those bits. Then they say, of course, the functioning would have declined. And that's
Yes.
when you know that that
It should
person
impair
is
functioning.
depressed. So there's
Yes.
impaired functioning, and
Yeah.
you won't be able to sleep, you won't be able to do your job. But when you go to high functioning, instead of you not being able to do your job, you're depressed, but you're still functioning. So it is like you're trying to cover up for something that is happening within, and it comes from a place of trauma. So the risk factors would be that people that that you're from a very low socioeconomic background, you're trying to meet meet up a particular, try to break a particular a particular lineage, or break a particular cycle, generational cycle of maybe poverty and all of those things. You just want to make ends meet. I just want to become successful in life, and you're trying to, you could have high functioning depression. The people of color as well, that at higher risk of having high functioning depression. Females, yes, of course, depression is higher in females than males. High functioning depression is also higher in females than males. And also high professionals, doctors,
Yeah.
lawyers, and all those, are also high risk. Those are the risk factors.
Thank you so much, Dr. Adiola, for capturing that very well. I mean, you've given us the risk factors for burnout, you've given us risk factors for high functioning depression. And I like the fact that, where you identified the high functioning piece of depression as a trauma response. It brings to light the common ones for the responses would be the freeze, flight,
Hmm.
fight, and
Hmm.
all that. But there's a fourth one too with the fawn response that we're realizing that for the people pleasers, the codependents, and
Yeah.
then you just just keep going to please people even when you're breaking down, and that might be in that category. While where there is the freeze, the depression should get you frozen. But from what you're saying, you're not even freezing because you're depressed and probably afraid of being eaten by the lion, but you keep going,
Hmm.
and that right there. So I like that you capture that very well, where not everybody may have the typical signs. So if you're listening to us, I hope you're taking points, listen, learning that even the person even you may have high functioning depression where you're just smiling, keep it going, but deep down inside you are struggling, you are dying inside, you're stressed out, overwhelmed. There are times you can be anxious. We are meant to have all ranges of emotions. That's the way life should be. If you only have one emotion through your life, practically there's something wrong. So get help. You should have variety of emotions. You're smiling, you're disgusted, you're excited, you're sad, you're crying. We're meant to have all of those. So having all those, but you should not be having all of those within a minute, though. That's another conversation. But if you're not if you're not expressing yourself, if you're not showing up your whole self, then something else is missing. Because every time you need to double down on an area, you are not authentic. You're not
Absolutely.
bringing your whole self to the table, and frankly, you cannot give what you don't have.
Hmm.
So again, like you said, I like where you're like, we become sensitive. So at times, it's not what was said to us; it's what we heard. And that also can be from our experiences because we're sum total of all our experiences. We carry
Yeah.
that with us. My childhood, my teenage years, all of that, I carry that with me. And it's very important for me to process that, as we know about the cognitive triangle of thoughts and the feelings and leading to our actions. So it's very key from what you're saying to be able to recognize it. Is it my thought? Is it internal? Is it my feelings? Is there something within me that I need to deal with? Or is he external? Like you said, we can't fix that. The system, the boss is the boss.
Yeah.
Do I need a new job? Maybe.
Maybe.
Is the boss
Maybe.
is here to help me grow? If the boss is not really helping you grow, then maybe it's time to bounce. It's time to leave because again, you need to know your purpose. Does this align with your purpose?
Yeah.
Is it taking you towards your growth? Is this helping you grow or destroying your growth? So it's very key. So I'm going to move on to our next question, which is Dr. Diola, you have vast experience. Reading about. I mean, Dr. Diola is You know, she's well exposed, well, with great, should I say, diverse wealth of experience. She's licensed in Nigeria. She's practiced in Nigeria as a psychiatrist, practiced in England. And so I just want you, based on your experience, comparing the culture, the communities, what would you say? Is it more common? Does culture, what is the role of culture in
Mm,
burnout? What is the role of culture in high
mm.
functioning depression in your experience?
Yeah, culture is very important, honestly. And that's why, I mentioned when we talk about the risk factors, immigrants, right? The people, people of color, as they say, at higher risk because immigration in itself has been proven to be a risk factor for mental illnesses, right?
Yeah.
So when you're back home in your comfort zone where you have your people, things that you're, familiar with, you may not necessarily struggle mentally because of course you have the support. You don't have to, there's no culture shock, there's nothing to surprise you. You're not trying to walk on eggshells, trying to see how to adapt and adjust. So like you said, I trained from Nigeria as a psychiatrist. I've spent all my life in Nigeria before I moved like 4 weeks, sorry, I said 4 weeks, 4 years ago to the UK. And I know the difference. Like the difference is clear in terms of how things work here. And the fact that you've even lived your life almost like 30, so I'm 42 now, so like 38 years of my life in a particular place. And I'm coming here to learn how things work. That is not definitely not going to be the same.
Yeah.
So the truth is that in terms of culture, coming back to your question,
Yeah.
people when you live in an area where you have there's a commonality, the same people, your own people are there, you tend to thrive better amongst your own people, and there's less risk of mental health issues including burnout syndrome and high functioning depression. It's because of course it's your people, it's how you were raised. You don't have to really try to adapt or change in any way. And of course, it has its own risk as well. So maybe you might have opportunities, you might not have opportunities, but of course, it may not impact your mental health basically. But when you move to a place where your people are different, trying to stand out in a place where you are different will take a lot of courage and audacity. It takes some boldness, and sometimes you'll be criticized. I've had experiences I don't want to mention on this live. You'll
Mhm.
be criticized and you'll be talked down at. So it
Mm.
takes you being visible and trying to say that I am actually good. I have the experience, I have the knowledge, I have this. And then you have to kind of show that you are good and have the develop the thick skin to absorb some of the critical comment that come to you, even if they are in a very nice way, but you know that it's actually been critical of you. All of these things can impact your mental health, can cause burnout. And because you're coming to a place where things are done differently. So you practice, say for instance, as a doctor somewhere, where
Mhm.
you're familiar with, and learning how things work here might add a layer of stress on top of your work. You get what I mean? So,
Yes.
say for instance, in Nigeria, we do more of paper documentation. We used to do that, and things might have changed now. And then you're moving into the UK where things are done by typing and all that, dictating. So some
Mm.
of us had to learn dictating and all of those things, which would then add extra layer of stress to
Mhm.
what you do in culture shock. The kind of mental illnesses that are common in Nigeria is different from the kind of mental illnesses here in the UK. So you're trying to learn how the communication is here and all of those things can add on top of you. And the truth is that when you become shameless, because shame is one of the reasons why people suffer with high function depression and burnout. But until you become
Mm.
shameless and try and
Mm.
start speaking up for yourself, that is when you
Mm.
can be free from all of those things. You have to learn to be shameless and speak up. I'm struggling, I can't do this. Say
Yeah.
it. You just have to speak up for yourself. And that's exactly when you start becoming free. Because I think it's the belief that you people believe they need to I need to be perfect, I need to do these things. It's what
Mhm.
but then when you're struggling, you're struggling. If you're struggling, you're struggling. It's not you can't hide that. You can't pretend. When you try to pretend, when you try to cover up, it gets worse. So the best thing to do is to be shameless and be confident enough to speak up and ask for help.
Wow, Dr. Diola. Wow, I love the piece where you said shameless. Wow, I'm taking that with me. Be shameless, you know? Yeah. Um, oftentimes I'll be like, just strip yourself of people's expectation. It's not,
Absolutely.
just strip that. And I like what you said. And at this point, Doctor, in case you didn't know, Dr. Della is an author of the You Deserve Bliss book. It's on Amazon, and we're going to delve right into it quickly to share what she has done and what she recommends, because that's where we're going now. We already know the risk factors, we already know what it is and what it's not. We know what burnout is and we know what it's not. We know what high functioning depression is and what it's not. We know the risk factors, we know the signs, and now we're going to talk about what to do. We can know all of these things, and at the end of the day, like, Dr. Tiwa, I still don't know what to do. So here we are talking about. Dr. Jola is going to share with us on how to have bliss, because you deserve bliss. Your spouse, your family, everybody
Everybody.
deserves bliss. So we're going to let her take it away and just give us what you can do and how you can even help the next person. So maybe you're another one burned out and you're just like, I don't know how to help my friend. I feel
Mm,
helpless. We
mm.
we we have you covered, because nobody likes to feel helpless. And when people feel helpless, you may be under pressure to say what you shouldn't even say. You may be under pressure to give the advice that you have no business giving. So,
Yeah.
Dr. Diola, please help us. Teach us what to do and how to handle maybe first burnout in work setting, and then what to do in high functioning depression.
So thank you so much, Dr. Tiwas. You deserve bliss, as you can see when Dr. Tiwa, showed us. Is a book I published in 2022. Was 2022? Yep, I passed my exam. Yeah, 2022, September 2022. That's about 3 years ago now, and it's a book that is so dear to me. It's the book what I literally did is what I wrote in that book, more like my journey. So when I moved into the UK 4 years ago, my baby, I had my 3-year-old toddler and a 10-week-old baby. And I came into the UK, and I started doing on calls, right? Whilst, of course, I wasn't entitled to mat, and I was on mat leave in Nigeria, but I came into the UK, so I wasn't entitled to mat leave. And the only reason I came into the UK was to work. So I can't not work. I could not work, so I had to work. If there is any English like that, I couldn't work. I had to work, and I would express breast milk in the call room for my daughter, you know. So whilst I was doing all of that, I also preparing for exams, because I know that I can't just continue to do this. So I have to get my qualification as a psychiatrist in the UK. And within 18 months, I passed all the exams whilst doing all of those bits. And some of the things I did were what I put together in the book, You Deserve Bliss. And it's all about self-care. It's all about prioritizing you. It's all about getting the help you need. It's all about putting yourself first, basically. You know how they used to say that when you put yourself first, you're being selfish, you have to
Mm-hmm,
love
mm-hmm,
everybody. But
mm-hmm,
what my Bible tells me is love your neighbor as yourself. So you can't give what you don't have. If you
mm-hmm,
don't love yourself, you probably can't love someone else. So whatever it is you are doing to another person, when you don't actually love yourself, it's coming from a place of depletion,
mm-hmm.
right? And
Correct.
it's probably because you're traumatized. You're trying to gain the attention of the person. That's why you're showing love that you don't even have for yourself. And that's why, the way I put it in that book, I was quite blunt. I just tell people, put yourself first, I've got people said, oh, this and that. I said, see, in this life, you have to, there's no one coming to help you. You are responsible for
Mm,
yourself. And
correct.
the only time that you can be your best self to everyone around you is when you yourself are full. So your cup
Yes.
is full. So this cup, I'm almost done with the juice in it. If I don't have anything, would I have anything to pour out to Dr. Tiwa, for example? No.
Yeah.
So the truth is that you have to learn to prioritize yourself. I know women are those that struggle with this, and it's because we are naturally nurturers. We have that mindset. We've been conditioned to believe that we are the peacemakers, the homemakers, and that's why we are at risk of burnout. Women are at higher risk of burnout. Women are at higher risk of high functioning depression, and it's because we keep giving. We want to be there for our children. We want to be there for our family, our parents, and all of those bits, and we forget to put ourselves first. So what I tell people is that the fact that your children, if you're a mom, your children need a happy mom, not a one. They don't need you stressed. Just taking that break to say, I need some time. And the same applies even in the workplace. Telling your boss that I think I'm burnt out. I need a break. I need some days off. Honestly, you need to start speaking up. Like I said, you need to be shameless. You need to start putting yourself first, prioritizing your well-being, sleeping well, eating right, exercising. Like I tell people, not all males, you need your immediate attention. You don't have to respond to all the text messages, all the emails
Yeah.
immediately.
Yeah.
Because
Yeah.
out of fear, a lot of people will be like, oh, what would that person say? But if you continue to do that, the truth is you are not dispensable. No one is. The job will continue. The other day at my
Correct.
workplace,
Yep.
one of
Yeah.
my colleagues slumped and died. I know what happened. We were sad, but then the work continued. The work continued. So I tell people, see, I know they will definitely be, the kind of upset with you when you don't get your task done on time. But you have to ask yourself, would you rather pass on top of your job? Would you rather let that happen to you? Would you rather let your mental health suffer because of your job? No. So I think we just need to start opening our eyes and start finding the right balance,
Yeah.
making sure that we put the things that are right first. Because at the end of the day, if you want to become more productive in the workplace, then you have to, have taken good care of yourself enough to be able to give your best at work. So yeah, that's what I say.
Wow, Dr. Della. Thank you so much. I know we're right at the top of the hour, so I'm just gonna a few more minutes and then I'll let you go.
That's
Because
fine.
we didn't start on time. So a
Yeah.
few more minutes and then we'll finish up. But I like what you said, which goes back to exactly what you said of be shameless. I just feel like once you strip yourself, once you disconnect from perfectionism, I always tell people that perfection is a delusion,
Yeah.
and the only people perfect, they're in heaven for a reason. They're gone. The only person that came that was perfect didn't stay for too long, and that was
Yeah.
Jesus.
Yeah.
So, and maybe the first set of people that were, Adam and Eve, they were perfect until they were no longer perfect.
So that
But
means
the
that they were
person
not perfect. Because if
exactly.
they were
So
perfect, then that wouldn't have
anybody else. So
happened. Yeah.
I echo exactly what you said. Where
Mm-hmm.
disconnect from that, divorce that relationship, break that relationship with perfection. However, we would try our best to aim for excellence. Excellence
Absolutely.
is doing the best capacity, best of your abilities. Make
Mm-hmm.
sure you are at that point. And excellence is progressive. It's helps growth. It fosters growth when you aim for that, rather
Mm-hmm.
than pursuing perfection, where you criticize yourself rather than criticizing the situation, rather
Mm-hmm.
than having the critical analysis of what you have and what you don't have. Which I like what you said, where look inward, ask for support. I'm an advocate of asking, speaking up, seek
Yeah.
help, and support others. So if you're listening to us, before I ask Dr. Adela, my next question is, I hope this conversation is triggering thoughts, it's triggering analysis of gaps. What do you have already in your strengths, in your self kits, in your toolkits? I always say, well, we have the emergency, we have first aid box. You have your own mental health kit box. Have it. What is in there? Because you don't want to wait until you're struggling. At that time, it's too late. You
Mm-hmm.
already want to have your own tools so
Mm.
that when you're struggling, okay, I'm going to call Dr. Sue, I'm going to call Dr. Joel, I'm going to call my mom, my dad, I'm going to go out, what it is. It's have what you do so that once you recognize those signs, Those yellow signs, when we're driving, green is go, yellow is slow down. But some of us, we still go. But yellow sign is slow down. What I'm asking of you is have those things, your tools for yellow sign. Have those tools for red.
Mm-hmm.
But yellow, you don't want to be red, is why you need to be equipped in yellow so that you don't get to red and then you're already done. And then we have to wait for 1 year for you to come back.
Yeah.
So it's easier to maintain, it's easier to recover, it's easier to recognize quickly before it gets too late. Because again, when you've packed up, when you're exhausted, you it can take a lot to rejuvenate you. It can take a lot to repair. Even though it's possible, it's not impossible. It may just take a longer time. So my question, Dr. Diola, before we wrap up, would be: you mentioned Bible. Can you speak to a topic we don't always speak about, and that's the spiritual exhaustion, the spiritual burnout too? So what would you say in the context of faith? Someone listening to us that is like, you know what? I thought, like you were saying, um, I should love. How do we balance? Because in the same scriptures, love your neighbor as yourself was Moses. But when Jesus came, even though he built on that, he went further. You should love others the way I've loved you. So how do we balance that? How does faith? Because faith, like I say, we need to be careful. Faith communities, faith discussion can be very judgmental, very critical, very it can be unwelcoming. And that's why we're having this conversation, because church is a hospital. It's a spiritual
Yeah.
hospital for the pastor and everybody too.
Yeah.
It's a hospital for the soul.
Yeah.
So how do we balance that when we have faith? If somebody is listening to us now, like, you know what? I'm very curious. I would like to bring faith into my kit for self-care. Like you rightly said, like your Bible. How would we say it? And I like what you said about we need to be, you have to first be grounded before you can help somebody else.
Mm-hmm.
Otherwise, if you're not grounded, both of you are going to fall in the ditch. And then
Mm-hmm.
the person you came to save will just tell you, why did you come? Because you
Mm-hmm.
are not useful. And
Mm-hmm.
so, how do we balance that, faith? Like I said, some people of faith feel guilty. Like, am I not being selfish if
Mm-hmm.
I'm not responding on time? They
Mm-hmm.
need me. When you're not even Jesus or El Shaddai, but they need me. So please, how do we reconcile spiritual integrity in the context of faith, spiritual responsibility to our neighbor, and spiritual exhaustion? How do we balance that?
That's a very good question, and I think you've made mention of some things. You said we're not El Shaddai. I tell people you're not God. It is not your responsibility to fix adults. You can't control people. You can't change people. God is the one that can change people. So anytime you try your best to be in people's lives, trying to change them, trying to help them change, or then you're wasting your. It's a waste of time, honestly, because if you want to help someone, then the person has to be willing to be helped. So you need to first of all understand that. And the second thing I need to say is I always talk about, I think I said it in my book as well, You Deserve Bliss, that self care comes from, we're tripartite beings and we've got spirit, soul, and body. So you have to take care of those three parts of you. And it is your responsibility to do that. God also wants you to take care of your spiritual health. God does not want you to be exhausted. If he wanted that to happen, he wouldn't have created heaven. I mean, all the resources Adam and Eve needed before he created them. So he didn't even want them to work. They were enjoying until it was sin that brought us to where we're at now. You get what I mean? So we were meant to just be flourishing, be fruitful, multiply, dominate, enjoy. So you need to understand that and have it at the back of your mind that God wants you to enjoy your life. So anytime you are doing something for someone and it's at the expense of your own well-being, then it's a loss. So whatever it is you give out, it is always at the expense of something. So whatever it is you want to give, ensure that you have it. Say for instance, someone is going to call you. Dr. Tiwa came to me and said, I want to have this session, 1 hour of your time. So it's going to be at the expense of something. Maybe I could have slept within this 1 hour, or I could have had time with my children with this 1 hour. Then it's definitely going to be at the expense of something. So I have to carefully check my diary to be sure that I have that time that I want to give. It's as simple as that. You can't keep picking all calls, keep responding to all messages, keep giving to everyone that come to you. It's not going to work because you are not God. You are still human and you have limited resources. And God cannot just expect one person to be there for the whole world. So I tell people that's how you tell yourself. I know there's a thin line between being taking care of yourself and putting yourself first and being selfish. I'm not saying be selfish. I'm saying sit down carefully and check your resources and be sure you have what you want to give. So you have to sit down and think about it. And that's why I tell people you don't have to respond immediately when people come to you. Give it a thought, go back and think and reflect on it, and be sure you have what you want to give. Another thing is that you don't necessarily have to give when they ask you to. Sometimes we feel compelled to do something, we feel obligated. I have to do it. You don't have to do it. You don't. So you have to, first of all, erase that, clear that from your mindset to say, I have to meet this need. No, you don't. Because that person that has come to you, if you are not there, they will get someone else to help them. So if you're going to give them your last, whatever it is you have, then it's going to be at the expense of yourself or whatever is important to you. So I need you to always remember this, that yes, God might have placed some resources in your hand, but you also have to use your own wisdom to think carefully to be sure that you're doing the right thing for your own well-being and for the well-being of the people that are dependent on you.
Thanks so much for sharing that. You've covered several points. And my last question about the faith, and then we'll get you going, would be how can the faith community, how can even work? How can communities, how can they support their people? So like work, you need to work hard, you need to work. How can they support even church the same? Workers, how can there be a balance? So what would you, if there's somebody listening to us now that maybe is a pastor or a leader at work and at, communities, just different communities, how can we support, or maybe a spouse that is just, or a parent that, my child may be burned out, or even, what are the, what can we do? What can they do as they listen to us?
So I think the best thing they could do is listen to people. Let's stop being dismissive of people's symptoms. So the reason why I would come to you, Dr. Tiwa, is if I'm confident that when I speak to you, you won't downplay my symptoms or you won't downplay my struggles. Many a times I see people struggle to open up to a certain set of people just because they feel like mental illness is not my portion in Jesus' name. It's not your portion. Stop saying that. So that will be the end of the conversation. The person will never come to you again. But we have to start creating safe spaces for people to be vulnerable with us. Let them come to you. Listen to them. I tell people you have to learn to listen, not be quick to give responses or give them advice. Oh, do it this way. And all. Listen to them. Sometimes what people need is just a shoulder to cry on. So just listen to them. And when they are done, you can ask, so how do you want me to support you? Rather than saying, oh, let's pray about it. How do you want me to support you? Let the person that has spoken, let them be the one to give their own way of the way they feel they can be supported. Sometimes what some person needs is just thank you for listening to me, and that will be all. But when you're already saying, I want to pray for you, you can pray for them without them being there, but don't be eager to give advices to people when they come to us. Just listen and let them feel seen and heard when they come to you. Yeah.
Wow, thank you so much. I appreciate that a lot. And I like what you said. The key thing that I'm going to emphasize is ask the person, listen, and then support. How can I? Because support is different for everybody. So I can't assume that you need a day off. You may not even need a day off. It may just be that the workload needs to reduce. And in church too, you may not need a day off, but maybe you just need somebody else to take on delegation. Just take some things off my task, off my table, So it's very key, and I'm emphasizing that support is different to everyone. It's key to ask what it looks like. So thank you so much for the robust conversation, the great, gems you've dropped. So what would be the last words that you would like us to keep in mind as we sign out?
So what I'll say is that if you're listening to me, choose what's it called? Choose wisdom over burnout. All right. Choose purpose over pressure. So life is in stages. Life is in phases. Focus on your journey and don't compare yourself to anyone. Don't put yourself under undue pressure because those are the things that will get you stressed and burnt out. So just choose purpose. Work in your purpose, focus on your journey, focus on your process, and be grateful for how your journey, how you're moving, how you're proceeding in your journey. Or how you're progressing. That's the word I want to use in your journey. So that's what I say.
Thank you so much, Dr. Diola. It's been a pleasure having you. We appreciate the time. And to our audience, what do we say? Thank you for your
Thank
patience.
you.
With the technical glitch, you're still here. Or those that will listen to the replay, thank you. We're
Yeah.
just grateful for your support too. And with that, we're signing out. Enjoy the rest of the weekend, everyone. Bye for
Yeah.
now.
Bye.